Scanning the room.
Hello, my name is Sarah New and I am a nursing student at Wilson State College, and today I'm going to be demonstrating how to administer a piggyback IV medication. So first things first, I need to get my doctor's orders and compare them to the MAR and make sure everything matches. So just make sure I have the right patient, Shirley Coast, date of birth matches. I can see that my patient is allergic to promethazine and codeine. So as I'm verifying, I'll make sure none of these meds have that. So at 5:30 this morning, the patient was started on 1,000 mils of normal saline to be infused at 100 mils per hour. I've been taking care of her, so I know that that's infusing. And the doctor has also just added orders to add a 1 gram of ceftriaxone to the administration in a 250 ml bag of normal saline, so 0.9%. Everything matches, we're good to go. So I'm going to go ahead and go into my med room now. So I'm in the med room, I have performed hand hygiene. I'm going to access my client's record. I've got the MAR. So I'm going to the Pyxis. I'm going to pull out my first medication, do my first med check. Make sure that this is not opened, it's not compromised in any way. The color is good, it's clear. That it is 250 mils of 0.9% normal saline. And it is a pre-prepared bag, so it does have the ceftriaxone in it. I know that it is 1 gram. So, okay, my first med check is done. So I'm gonna go ahead and open the bag and do my second med check. And before I do that, I'm gonna go ahead and put on gloves. Second med check is again confirming that it's the correct amount, 250 mils is the correct type of fluid, 0.9% normal saline. Make sure that my patient label matches my patient and that the medication matches. So, and it does. And you want to put this on the back. Okay, so that's good to go to the patient's room. I need to gather all my supplies. And I have now entered the patient's room. I would introduce myself, explain the procedure, confirm that everything is still running, assess the IV site. If I didn't see it already, I'd confirm the patient with name and date of birth, ask her about any allergies, and just know that nothing that she's getting today has promethazine or codeine in it. So we are good to go. I would have taken these off in the med room and performed hand hygiene. So at this time, I can go ahead and do the same thing, put new gloves on. So I'm going to do my third med check after I prepare my tubing. Don't need that. Okay, so you want to make sure your clamp is closed. Just pop in. All right, make sure that's closed. Get your bag. I'm going to pop it. Okay, so you get in there, you're gonna go ahead and hang it. Squeeze your drip chamber. About halfway full. Okay, and then slowly open your roller clamp. After you aseptically remove this. And you just want to prime it just enough to get it at the end so you don't lose any of that medication. Make sure all those bubbles are out. That's good. All right, so that's good to go. I'm going to go ahead and hang it while I prepare the pump. So we're just going to go in. You're going to press B and clear line B settings, yes. We're going to do a piggyback, and we want to infuse this at a rate of 250. And volume to be infused is going to be 250. And we have confirmed that with our MAR and our dosage calculations. Okay. And first we would have gone to the drug list. And I'm going to scroll page down because it's actually programmed in here. So we go down to the antibiotic, 250 mils, enter, standard, choose. Okay, so then it has your piggyback and your 250, so you don't actually have to enter that. Okay. So now we want to just confirm that that is correct. And then we just would go ahead and press start after we did our third med check, making sure that everything matches. Good to go. So before I do that, I need to go ahead and clean this and connect it. So before you do all that, you do your third med check. There's that. So we're going to clean the hub, 15 to 30 seconds. Okay, making sure that's closed. Attach. Open, and then you would go ahead and press start and just confirm that all of your amounts are correct, and they are the 250. Yes. All right, so that is infusing. At this time, I need to go ahead and stay with my patient for a good 10 to 15 minutes, make sure they're not having any kind of reactions to the medication. Do another site assessment. I'm going to document everything that I've done. I would make sure to add my IV label, my IV tubing label, so that the next nurse coming on knows when this line was started. So yes, so you document all your fluids infused, the amount infused, time, date, who infused it, how the patient tolerated it, and I believe that's it.